Hello, I'm Jonathan Nelson for the New Jersey Academy of Family Physicians with a special report on the value of family medicine and the medical home. In America, we pay significantly more for health care than in any other nation in the world. Each year, that cost outpaces the rate of inflation as the country searches for a solution. Your academy leads a chorus of organizations touting the many benefits of the medical home. But what exactly is the medical home?
To me, a medical home is a place where patients can come to and know that they can get medical advice, they can get treatment for some problems. I have a basket or a toolbox of services that I offer to patients. And then if I don't offer something, I can offer the person who can give them the service that they might need beyond that. So I'm their link into the medical community.
The patient-centered medical home gives patients a personal primary care physician who leads a team of individuals dedicated to providing comprehensive and continuous care. In a medical home, physicians employ systematic solutions to ensure patients receive safe, high-quality care that's coordinated across all components of the complex healthcare system. Patients enjoy enhanced access to their physicians, and physicians are paid appropriately for managing their care.
I think that the medical home is what we've been doing, what we've been trained to do for the length of time of this family medicine movement, which has been at least 40, probably 60 years total now.
Ever since I decided I wanted to be a physician, I wanted to do family practice simply because I wanted the interaction with the entire family and to be able to give patients a complete scope of care and also to be their advocate into the healthcare system.
Several recent studies have shown that in areas where primary care physicians provide the majority of the care, patients receive a higher quality of care at a lower cost. Increased access to family physicians results in lower rates of all-cause mortality, fewer emergency room visits, less duplication of expensive services, and more preventive care, all of which leads to more efficient usage of health resources and better outcomes for patients.
The barriers that we see that are quite unique to the Northeast and maybe even worse in New Jersey is the inverted pyramid for specialists versus primary care doctors. And that has been shown in New Jersey's case to leave us with a healthcare system that is top-heavy, very, very expensive, and not necessarily good quality. So all the evidence, all the studies done have shown that a person having a medical home or a patient-centered medical home is the way to turn that system around.
As patients get sicker, or as patients have conditions that can be treated longer, they get increasingly complex healthcare needs. And a family physician has been shown in many academic studies, it's well documented, show that the family physician is involved with your care. You have lower morbidity and mortality rates.
Ensuring all patients have a medical home will require physician payment reform that encourages and rewards high-quality, comprehensive, and continuous care. That's why your academy is working with AAFP and other physician organizations, as well as consumer groups and large employers, to make the patient-centered medical home the foundation of our healthcare system.
Everything we do is focused on the survival of the family physician. Now, that doesn't always mean, but sometimes means that we're focused on payment, how to make sure the family physicians are adequately paid for the work that they do. But often it means something far more, what I think is more important than that, and that's just ensuring that those family physicians are capable of practicing family medicine the way they're taught to practice, the way the model of family medicine was designed, so that they can deliver to their patients the kind of primary care that this system is step by step eliminating, and it's tragic for patients.
When you consider the growing cost of medical care across America, there are certain common sense approaches that we should be turning to. Medical homes would be one of those. to make sure that primary care physicians can be in direct touch with families on a regular basis to provide them the best and most economical health care.
For more on what your academy is doing for you and to learn how you can get involved in the fight for family medicine, log on to the Academy's website at www.njafp.org. Reporting for the New Jersey Academy of Family Physicians, I'm Jonathan Nelson, and this has been your Academy in Action.